How are you?
Hello, doctor.
Dr. Luis Rodriguez. Nice to meet you.
Nice to meet you.
Nice to meet you, Enrique. So, Enrique, tell me what brings you in today.
My primary physician referred me because I'm diabetic. Said that I need to have a free checkup.
Okay, so this will be your
First time.
diabetic evaluation with a podiatry doctor.
That is correct.
Okay, so this is our first evaluation. We're gonna do a full history and physical of your lower extremity. I'm gonna start by asking you a battery of questions. I wanna know a little bit more about your background, your medical history, so that we can have a full comprehensive exam with you today. Okay, that sounds good?
Perfect.
Good, good. So you said you have any pain at this
No
time,
pain.
any discomfort?
No,
No?
no discomfort.
Okay, so let me ask you a little bit more about your past medical history. You said you're diabetic.
Yes.
You're diabetic type 1, type 2,
Type 2.
type 2. Do you check your blood sugar regularly?
I take it every couple of days.
Okay, what was it last time you
Last
checked?
time was about 110.
110. Okay, good. Do you check or do you know the value of hemoglobin A1C?
My doctor educated about it. And the last time he measured it was about 6.4.
6.4.
Yes.
Okay. Do you have any other past medical histories like hypertension or high cholesterol that you know of?
Overall, I'm very healthy.
Heart problems or
No.
okay, so everything else is okay. You have any, okay. Now, do you have any past surgical history? Any procedures they have done?
No.
No, none. Good. That's good. What about in your family? Are there any medical conditions for your parents, your grandparents that you know of?
My grandparents are diabetic.
They're both diabetic.
Yes.
Okay. Hopefully they're doing well.
They're doing well.
Okay. Good. Medications. What medications are you taking?
Only metformin.
Okay.
For diabetes.
Any other supplements that you're taking?
Vitamin B.
Vitamin B. And your primary doctor is aware of all this
Yes.
medication as
Yes,
well?
yes.
Okay, good. Do you smoke?
No.
You used to be a smoker in the past?
Never.
Okay. Do you drink
No.
alcohol? Do you
No.
drink? No. Okay. Do you use any other illicit drugs?
No.
Okay. None whatsoever?
No.
Okay, perfect. Good. Allergies. Any allergies to any medications or any other materials, dust, or the environment?
No. No allergies.
Okay.
Maybe cat hair.
Maybe can't hear, but
That's it.
other than that, any medications, penicillin? No, none. Okay. Perfect. In this part, now we're gonna do a full examination of your lower extremities. Okay. I'm gonna set you up a little bit better here to position yourself. So the first part of the examination will be a dermatological exam. I'm going to be looking at your skin and making sure that you don't have any dermatological lesions, what we call macules and papules, or any blisterings or bullous formations that can form. Okay. I can see the hair growth all the way proximal to distal to the digits. A little bit of dryness I see on the lateral aspect of both legs here in the skin. Looking for any type of opening of lesions, especially with diabetics. Always make sure you look at the heel. No types of lesions noted between the digits, interspace, no wet space maceration. None noted bilateral. We see a little bit of a mole here on the medial aspect of the fifth digit. You always had that?
Always. It's always a child.
Never getting any bit bigger,
No
or
change.
itchiness in the area or anything like that?
No.
Okay, good. Looking at and evaluating your nails. 1 to 5 bilateral. They'll look normochromic. No discoloration, no thickening, no signs of ingrown formation on the nails. Okay. A little bit of hyperkeratotic tissue or callus formation here noted on the medial aspect of your hallux. Other than that, there's no open lesions, no signs of infections noted to bilateral lower extremity. I'm going to go ahead and do a vascular evaluation, try going to feel and palpate for your dorsalis pedis pulse. Dorsalis pedis, the pulse is palpable, +2 out of 4, bilateral. Looking behind the medial malleolus, pressing and palpating for the posterior tibial artery pulse. I can feel it. The pulse is +2 out of 4 as well, bilateral. Okay, very important that we don't see any varicosities on the extremities in this patient bilaterally. There's no sign of swelling, inflammation. We're looking for the capillary filling time. Pressing on the digit, and that's it. Capillary fill time fills in. Okay. And in all digits, capillary filling time is less than 3 seconds bilaterals. No signs of clogging or cyanosis noted to the digits bilaterally. Okay, now we're gonna go ahead and perform a neurological exam. For this part, I'm going to use a monofilament, okay, to test your protected threshold, which is the minimum amount of pressure that you're able to feel. I want you to feel it on your hands, so you have a little sensation how it's going to feel. If I can get the top of your hand. Okay, so I want you to close your eyes and just tell me which area of your foot am I touching, or if you feel something, or if you don't. Okay.
Okay. Yes, I feel it.
Where?
In the big toe. I feel it in the third toe. Feel it in the fifth toe, yes.
Okay.
Yes. 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 Yes.
Okay, we're going to perform the same evaluation on your right foot. Just let me know when you feel something.
Yes. 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 Yes.
Okay, good. Perfect. That was really good. Really important to evaluate the diabetics with this test, because when you don't feel, you start losing sensation on the body of your feet, you can get problems and ulcerations can arise from those. We're going to do now the evaluation, vibration. So I want you to tell me if you feel the vibration and also when it stops. Okay?
Okay.
This is what you're going to feel. Just let me know when you start feeling the vibration and when it stops. Okay?
Okay. Okay, I feel it.
Tell me when it stops.
No.
Okay?
I feel it.
Tell me when it stops.
No.
Okay, good. Now we're going to evaluate for sharp and dull sensations. Okay, so I want you to again give me your hands so you see what you're going to be feeling. That will be sharp, and this will be dull.
Okay.
Okay, so close your eyes for me, please. And let me know if you're feeling something sharp or dull.
That's the one. Sharp. Can you do it again, please? Dull. Sharp.
Okay.
Dull. Sharp.
Okay, good. Now we're going to go ahead and test for your deep tendon reflex. Okay, I want you just to relax. I'm going to start with the Achilles tendon reflex here. I'm going to just gently dorsiflex the foot a little bit, then hit it with the hammer back at the Achilles tendon area. Okay, good. slightly dorsiflexion of the foot and hit the Achilles tendon. Okay, perfect. Now let's evaluate for your patella reflex here. So right here below the patella ligament, we're gonna hit it with the hammer, just like patella reflex. So that would conclude our neurological evaluation, and now we're going to do a musculoskeletal evaluation of your extremities. Okay, so I'm going to go into range of motion starting with the ankle joint. Okay, it's a little bit tight, less than 10 degrees of dorsiflexion. Going to be plantar flexion there. Evaluating eversion, subtalar joint, mid-tarsal joint as well. Then we'll look for the metatarsal phalangeal joint.